Hi everyone, welcome to researchmd.com. We got another biostatistics presentation today. We're going to look at the positive and negative predictive values. Again, my name is Pramil, Cheriyath, and I'm a program director in internal medicine transitional residency, and I teach medical students and the residents, and I'm a director of research. I'm a assistant professor of medicine at two major medical schools. So what is the importance of positive? Why do we need to know about the positive and negative predictive value? To determine the extent to which screening tests are able to identify or the likely presence or absences of condition of interest, so that their finding encourage of, so it can help us with the better decision making. All of this kind of help us with the diagnostic. So diagnostic tools, we can say that, okay? We can say like how a test performs under, in a real world situation by looking at the predictive values. They indicate the probability of correctly identifying a subject's condition by the given test results. So when you get a test results, we know how likely they're going to have it or not, okay? And then again, the last positive and negative predictive are influenced by the prevalence of the disease of the population. Remember that positive and negative predictive values are influenced by the prevalence, okay? So what is a positive predictive value? It's the probability the person who has a positive test result actually has a disease. That's the definition. Positive predictive value is the probability that who has a positive test, how likely they're going to actually have the disease, okay? And positive predictive value directly relate to the pretest probability, so you have to link them together. High pretest probability, there's going to be high positive predictive value. Remember that. So how do you calculate it? You make this our 2x2 table. You disease positive, negative on the top. On the left side, you got tests, which is positive and negative, and you put true positive, false negative, and true negative, okay? And then our formula is you take the true positive divided by true positive plus false positive. That's our formula, okay, to calculate positive predictive value. True positive divided by true positive plus false positive. Now, let's look at what is negative predictive value. What is the definition? The probability the person with a negative test results actually does not have the disease, underline, does not have the disease, okay? Negative predictive value inversely relate to the pretest probability. So if the high pretest probability, low negative predictive value. Remember that, inverse relationship, okay? Now, so what is the formula to calculate this negative predictive value? You got the true negative divided by true negative plus false negative. Remember that. We created the 2x2 table, then you label the top positive, negative. On the left side, you put like a positive and negative. And then sensitivity, what is the relationship between the sensitivity and specificity, okay? Increased sensitivity, there is increased negative predictive value. Increased specificity, you're going to have increased positive predictive value, okay? Remember that. So example, let's go to some of the examples. You got a healthcare provider utilize a blood test on 1,000 individuals, determine whether or not they will have a disease. Out of this, 450 individuals who had positive finding, 350 of them had the disease. Out of this 550 individuals who had negative finding, 500 did not have the disease. Calculate the positive predictive value. Please pause the presentation, do the calculation, okay? Now, let's look at our solution. You make the table, right? Disease positive and negative on the top, test positive and negative on the left side. You fill in the numbers, and the formula is positive predictive value, true positive divided by true positive plus false positive. So 350 minus 350 plus 100, so which is 350 divided by 450, you got 77.7%, okay? Now, let's look at another example right here. Healthcare provider utilizes a blood test on 1,000 individuals to determine whether or not they will have a disease. Out of those 450 individuals who had positive finding, 350 of them had the disease. And out of this 550 individuals who had the negative finding, 500 did not have the disease. Now calculate the negative predictive value. So please pause the presentation, make your table, and do the calculation. All right, now let's look at the answers right here. So we created this famous 2x2 table, disease, positive, negative on the top, test, positive and negative on the left side. And the formula we know, true negative divided by true negative plus false negative, which is 500 divided by 500 plus 50. So you get 500 divided by 550. So the negative predictive value, my friends, is 90.9%. Okay, keep repeating this exercise so you can answer this like really well. And always kind of think about the connection is also very important, right? when you talk about the first, high pretest probability associated with a high positive predictive value, and high pretest probability is associated with the low negative predictive value. And look at the relation. There is increased sensitivity, there is increased negative predictive value, and then increased specificity, there is increased positive predictive value. Okay, remember that. Thank you so much for watching our presentation. We'll be back with another presentation soon. Please subscribe to our channel. Thank you.